Well, hello. Good morning, good afternoon, or good evening, wherever you're joining us from. My name is Alice Bonner, and I am a senior advisor for aging at the Institute for Healthcare Improvement and also adjunct faculty at the Johns Hopkins University School of Nursing. And I'm joining you today. I'm privileged to join today to give you a few opening remarks for this event, where you're going to hear a lot more from a lot of experts and stakeholders and people who are feeling very much like this new report from the National Governors Association is really going to make a difference and have an impact on workforce, specifically direct care worker issues that we're all grappling with right now, perhaps now more than ever, related to both the times we live in and the challenges we face, and exacerbated to some extent by the COVID-19 pandemic, but certainly not unique to that issue. We have had challenges with direct care workers for as long as I can remember. And I'll just share with you that I began my career as a nurse and as someone who works in policy as a direct care worker. And some of you who've heard me speak before have seen me show you this name badge, which I still keep close to my heart and close. It's always in my desk drawer, and it is my maiden name, and it's an inexpensive little piece of plastic that was used in the old days. I have lots of other name tags that say things like RN and so forth, but the one that I really cherish is the one that I got when I was a direct care worker. I was, you know, 19 years old, and I was in college, and I needed money, and that was how I got into the field of long-term care and working with older people across lots of different settings. So I know that a lot of you who are listening in today either work in the field, you work with older adults, you are an older adult, such as myself, and a lot of you work with NGA, the National Governors Association, on a variety of related issues. So, I'm not going to present a lot of data today. I'm not going to share a lot of statistics with you, even though I could, because as many, I hope most or all of you have done, I hope you've read the NGA report on the direct care workforce. And there's lots of data in there. There's lots of state specific data. And that's really important to all of us, because as we are going to try, as a matter of fact, I'll say, as we are now trying, many of us, and I hope eventually all of us will come together around these issues, to improve the direct care workforce in so many ways, to improve salaries, to improve benefits, more importantly, to improve the entire package of what we offer to people who would go into this as a career path. People who would say, when they're in middle school or high school or college, this is something I want to pursue. I want this as my career path. We have to really look at providing professional development opportunities for people who choose this as a career, not just a job. People need ways that they can have a career ladder or lattice, ways that they can become leaders, become teachers, become mentors to other people who are going into this work. So, in the NGA report about direct care workers, what you'll see is a number of initiatives. Some of you have participated and actually led those initiatives. Maybe you're going to speak on the call today. And it shows us where there are best practices, where have things really succeeded. And in some cases, it may be with some grant money, state grant money, federal grant money, municipal support. It may be from philanthropic dollars. But there have been a lot of ways that organizations have come together, professional organizations, health systems, state agencies, and others. And so, what I think we really want to do next is say, okay, there's been all this great work around the United States. around workforce, and we've looked at what people have done in other countries as well. How can we now really take action? How can we prioritize the work that has been done, that in some cases has led to improvements in recruitment and retention and support for one another? How can we take those and scale and spread across the country? What's the federal initiatives that we could think about together based on the state work that you're going to hear about during this event, and that some of you have been involved with? How can we move forward from here? So, as I said, this is personal for me because I started out as a direct care worker, and I imagine there's lots of people in this audience today who also have been a direct care worker at some point in your lives. The other thing is, I've been a family care partner for my parents, for my husband's parents, and we've come together as a family. And many of you in this audience, I would imagine, have also been a care partner for someone in your life. Might be a family member, might be a friend, might be a colleague. But those experiences are so valuable also. If you've ever tried to arrange services for an older person, particularly someone who's living in the community, someone who's transitioned from the hospital to going to a skilled nursing facility to going back home again. Older people move across all of these settings. So the other reason this NGA report is so important is it talks about older people and how we support one another across all of these settings. So there's information in there that whatever you do, we think it will be valuable and important. And certainly, we recognize that for some of us in different roles that we have in our professional lives, we can go up to a point in terms of recommending and making considerations for people to take forward and think about and implement ideas. In some cases, some of us cannot go beyond a certain point in terms of, we have to be careful about our roles. Some of us are not permitted to lobby, for example. But we need to think about what can we do. We can't just say, well, I can't, I have to be careful, I can't lobby, because that limits what we can do in terms of moving some of these initiatives forward. So honestly, and from the heart, I'm speaking to you and saying, when you get ready to go to bed at night, or when you get up in the morning and you're looking in the mirror and you're looking at yourself, look right in your own eyes and say, what could I do to make a difference? What could I do to prioritize this workforce crisis that we have right now and make a difference and really change things in a meaningful way? And I hope that what you'll get from this event is you'll hear lots of great information, you'll hear statistics, you'll hear who is this workforce actually. And again, these are largely women, women of color, people from different racial and ethnic backgrounds, but very often they're in a minority. People who are raising 2 or 3 or 4 children, very often single parents on their own. So these are the situations that we're looking at, and these are low income individuals. You'll hear a lot about that. Many of these people are on Medicaid, or they're on other, support programs to keep their families going. So because of who these individuals are, there are major issues with equity in this population. So we have to think about those issues, and we have to address issues of equity for direct care workers. So, the value of this report is in motivating us, getting us to move to action. Because if we just have the report sitting on a shelf, if we just use it as a talking point, yes, that's good, but it's not enough. So I hope that you'll think about direct care workers and how incredibly valuable and critical they are to the work that all of us are going to do together and that we are doing together. I want to thank you, all of you who are doing this work already, because we're standing on your shoulders and we need you to keep doing this work. And I hope that you'll find that there's a great deal of value in this event that you're attending over the next few days, and that you'll keep doing this work going forward because we need you and we really appreciate everything that you do. So thanks, have a wonderful event, and I look forward to continuing to work with all of you going forward. Thank you.